In the start of this lecture, we studied the example of propofol, where the drug first distributed to the brain and then returns to the plasma. This is the process of redistribution. Drug is transferred back to the plasma. This is commonly seen in drugs that are highly lipid soluble. Highly lipid soluble drugs given by intravenous or inhalational methods are initially distributed to organs with high blood flow. Later, less vascular but more bulky tissues such as muscle and fat take up the drug. While the drug is being distributed to less vascular tissues due to low concentration, in blood plasma, redistribution of drug occurs. Let's take an example of acetaminophen. Think about taking a 500 milligrams tablet that contains acetaminophen. You have just placed 500 milligrams of that drug in your body. Now imagine having a blood sample drawn from your vein about 1 hour later. From that blood sample, we measure the concentration of the drug in the plasma, and it is 8 micrograms per ml. Now let us ask a simple question. How much drug is in the body? We know what the concentration of drug is in the plasma, but we cannot convert that to a total amount without knowing the volume of the human container. In the case of acetaminophen, the volume of distribution is about 51 liters. Now you can multiply the concentration times the volume of distribution to arrive at the amount of the drug in the body at 1 hour post-dose. Now we can compare the amount remaining in the body, that is 408 milligrams, with the amount of drug administered, that was 500 milligrams. As you can see, the volume of distribution is just a proportionality factor that helps convert between amounts and concentrations. Giving you another example to explain particular factors such as diseased conditions can affect volume of distribution of some drugs. Drugs like calcium channel blockers are widely being used to treat hypertension, ischemic heart diseases, etc. But while prescribing a certain drug, you have to look into the pre-existing conditions of the patient and adjust the dose accordingly. For example, the volume of distribution is 2.4 to 6.2 liters per kilogram for verapamil. In cirrhotic patients, the apparent volume of distribution is higher than in controlled patients. That is almost 9.17 versus 6.15 liters per kilogram. Though not easy, I have tried to make these concepts easier for you. This was the D part of ADME series. Stay tuned to watch more.